A labiaplasty refers to a procedure performed to improve the appearance of a woman's external genitalia. The most common complaint that women have regarding their external genitalia is enlarged or prominent labia minora, which are the inner lips of the external genitalia. One of the most common procedures I perform is a labiaplasty, which tailors that tissue to become more harmonious with the labia majora and the external genitalia overall. So what that involves is either an edge trim technique or a wedge technique to reduce the size and prominence of the labia minora. At the same time, most women also need a clitoral hood reduction because most women who have prominent labia minora also have excess clitoral hood tissue. So at the same time, that excess redundant clitoral hood tissue is also reduced and tailored to achieve a more beautiful and harmonious appearance. Most patients have a labiaplasty performed in the office under local anesthesia. We start by applying numbing cream to the area. We have the patients apply this themselves. We then let that sit for a few minutes, and the numbing cream actually makes the area go almost completely numb. Next, I draw markings to guide the incisions and the final appearance of the labia minora. After that, I'll inject some numbing medicine, and most people don't even feel the needle sticks because the numbing cream works so well. After that, the excess tissue is tailored and removed, and the skin is closed up in layers with multiple sutures, which will dissolve on their own. If you don't want to take any Xanax or pain pills, a lot of women drive themselves to and from the procedure. If you need to take some pain pills or wish to take a Xanax or something to kind of take away some of the anxiety, you will need to have a driver. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.